Hello and welcome to NCTV episode 38, fresh out of lockdown version 2 in the UK. And today's episode is about what you can do to avoid joint replacement surgery. The most common joint replacements tend to be in the hips and knees, so we'll be focusing mostly on these areas. For the statisticians out there, by 2030, the demand for total hip replacements is estimated to increase 174% to 572,000 procedures, and the demand for total knee replacements projected to increase 673% to 3.48 million. In some cases, joint replacements are necessary due to debilitating pain, irreparable damage, advanced degeneration and chronic immobility, so they certainly have their place and can be a great treatment option. However, there are also some big risks associated with these procedures, and in most cases this should be seen as a last resort, as there are plenty of things that you can do and implement early in order to prevent being in a position where joint replacement surgery is necessary further down the line. Pain is the primary reason for joint replacement surgery, so if you can eliminate pain, you may eliminate the need for joint replacement surgery in some cases. So what can you do to keep your joints strong, reduce pain and avoid surgery? Your first line of defence is to maintain a healthy weight, because excess stress on joints can cause cartilage to break down more quickly. Losing just 5% of your body weight, or even just 10 to 15 pounds, can relieve excess joint pressure and make a huge difference. Although it won't replace cartilage, there should still be a reduction in pain and restriction. For best results, seek the advice of a dietitian or nutritionist to reduce calories whilst ensuring you're getting the baseline of what your body needs to build muscle and keep up your energy. A typical guideline is 130 grams per day of carbohydrates for both men and women, and 56 grams of protein per day for men, 46 grams of protein per day for women. Your second line of defence is to exercise regularly. This may be contrary to what you might think, but limiting physical activity can make joint damage worse. Inactivity leads to cartilage loss between the bones, and then can lead to bone-on-bone contact, which is extremely painful. Exercise helps to stimulate the release of synovial fluid and provides the cartilage with nutrients to lubricate and loosen the joint. Things like aerobic exercises and low-impact activities, such as the elliptical cross trainer, a recumbent exercise bike, walking and swimming at least 3 times a week, will help you to achieve optimal joint health. As a general rule of thumb, though, when it comes to exercise, if it hurts, don't do it. Sometimes it's appropriate to push through pain, but in general, and certainly when it comes to hip pain, modifying activities is the best way to avoid continued damage and pain. And one final point on the matter, be sure to wear the appropriate footwear that will provide enough support and cushioning to act as a shock absorber for your joints. Third, one of the main components of joint surgery avoidance is strengthening the muscles that support your joints. The quadricep muscles in the front of the thigh and the hamstrings at the back are key to knee strength. Every time you walk or run or do anything weight bearing, the quads absorb the shock, so the stronger your quads are, the less the load that gets transferred to your joint. Also, the gluteal muscles in the buttocks and flexors in the pelvis are important for hip strength and flexibility. Additionally, working on your core strength will keep your joints more supported and in better alignment. With daily exercise, you'll usually notice a difference in the muscles within about 4 to 6 weeks, but note that you can never go back to non-activity because the body doesn't restore your cartilage. If you stop, you'll go back to the way that you felt before. Fourth, the use of supplements like glucosamine and chondroitin can have beneficial effects on osteoarthritis. Fifth, Joint supports can be helpful, and if you take an arthritic knee, for example, you could use a knee unloader brace, which reduces the load on the painful side of the knee and shifts the stresses to the other side where there's minimal arthritis. Sixth, and in terms of medications for pain reduction, there are over-the-counter meds such as ibuprofen that people find helpful, although sometimes controversial for those in severe pain. Prescription medications like opioid analgesics can be administered if there is no response to other treatments. Seventh, injections are an option in the form of cortisone, hyaluronic acid and platelet-rich plasma therapy. These don't work for everyone, but if you do get reduced pain and inflammation from these, you should take advantage and use this as an opportunity to make other behavioural changes that will help, such as losing weight and exercising more. And eighth, which is last but by no means least, it would be amiss for me to not mention physical therapy with the likes of osteopathy, acupuncture or physio to focus on things like joint mechanics, pain control, muscle strength and improved joint range of motion to help fend off the need for joint replacement surgery. So that wraps up this episode. See you next time for some more bite-sized bits to help your health flourish. Bye-bye for now.